Now we'll discuss another method of imaging, and this is what is known as sinography. Some people can call it sinogram. Okay, so it's basically a way of trying to look through. If you look at the word sign, of course, something that is most closer to this is what the sinus tract. Okay, maybe there's an infection, then there's a tract along, so you want to image that tract and do a lot of examination. You use what? A sinography or a sinogram. So sinography, just so you know, it's a specialized radiographic technique, and it's used to evaluate sinus tracts. Okay, so sinus tracts are just abnormal channels. So those channels usually form when maybe there's an infection or because there's a pathology. Okay, that's inside the body. Okay, they form from the body right to the skin surface, usually so that what how do I call it usually so that what the pus can be able to track out. Okay, so it's particularly used in orthopedics for dictating chronic infections such as osteomyelitis, okay, all those osteomyelitis, or they can even map fistulas tracts, okay, after traumas or surgery. Okay, so what's the principle? So a contrast medium is usually what gently injected into the external opening of the sinus tract. So an X-ray images are actually now taken to the to trace the course of the tract. Okay, so the contrast outlines the tract, its length, direction, and any communication with bones, joints, or cavities. You understand? So from the surface, you are tracking, okay, this sinus that is on the surface, where is the root? Where is it actually from? Okay, so uses in orthopedics can be used to diagnose all those chronic osteomyelitis that cause a lot of sinus tract for the pus to leak out on the surface, post-operative complications, all those dictate fistulas that actually come as a result of surgeries. Can also used to be able to diagnose all the soft tissue infections. Okay, and to be able to differentiate, okay, to be able to know the source of one disease conditions and all of that. So you can have a simple sinus tract, you can have a complex sinus tract, you can have bone involvement, you can have joint involvement. You understand? Then advantages is simple, it's inexpensive, it's widely available. It provides direct visualization for you to be able to track a particular sinus tract back to its source. Okay, that is useful for surgery planning. You now know whether a patient needs a surgery or you just be using drugs for the meantime.